Hi, my name is Leanna Kaiser, and I'm here to talk to you today about safe patient handling when it comes to a vertical lift when transferring a patient from bed to wheelchair. The National Institute of Occupational Safety and Health revised the lifting equation, which presented with a maximum safe patient handling limit of 35 pounds. This means that it's recommended that when lifting a weight that exceeds this 35 pounds, that an assistive device should be used. And when lifting a weight that is less than the 35 pounds, this is within optimal lifting positions. What does this mean for the healthcare worker? Well, it limits the amount of manual lifting that they were already previously used to doing. However, this does provide for a safer environment for both the healthcare professional and for the patient, meaning that there's going to be less clinician injuries, less patient injuries, better body mechanics, and more efficiency. Communicating with our patients is also a very important thing for us to do. It can be a very scary thing to be put into a vertical lift without having prior experience to it. So it's extremely important for us as clinicians to explain the process of what to expect for our patients when it comes to using the vertical lift, as well as during the process of the vertical lift. You need to be explaining to them again what they're to expect, as well as reading their body language and their facial expressions to ensure that they're doing okay throughout the movement. So how do we use the lift? First, you need to properly choose the right size of your sling. They run from anywhere from small to extra large, and you need to keep in mind these 4 things: the area of the body the sling will support, where the seat edge of the sling fits on the body, the location of the leg straps, as well as the position of the overhead sling bar. Most lifts accommodate 350 to 400 pounds, but bariatric lifts may accommodate up to 1,000 if needed. You want to ensure before doing any activity that both your bed and your wheelchair are locked and accessible. The placement of the sling should be at the back of the patient at the level of the sacrum. And if the patient is unable to sit up for you to get it to their back, you can have them roll to one side then the next. Place the leg straps under each leg and cross them if appropriate. Once the sling is in place, then you can move the lift to the bed, extend out the legs so that you have a better base of support, and then you can bring down the boom, ensuring not to hit your patient when you do that. Put the sling loops onto the boom hooks, the ones closest to the head and then the ones farthest from the feet for the best position to put in the wheelchair. Bring them to the wheelchair, slowly lower them, and then when you leave your patient there after unhooking them, you want to make sure you do it in the best and safest position so that you can return to them and then put them back.